to be a role of fasting in helping with infection, at least in some studies. So there have been fasting in obese subjects has been shown to improve what we call natural killer cell activity and also antibody secretion. And I don't know whether that just means that these obese subjects were insulin resistant. And this was a 2-week-long fast. And I suspect that fasting for long enough duration was actually able to correct the insulin resistance. And this study, it was done in 1983. It's called Fasting Enhanced Immune Effector Mechanisms in Obese Subjects. So it's quite old, but they had actually very significant findings. So I suspect that if you're insulin resistant, it's not so much that fasting's magical, but correcting the insulin resistance might be magical. And in the Minnesota starvation experiment. But, and that went for 24 weeks and they were like 50% calories or something very low. They lost a lot of body weight over a 24-week period. But they found that there was no increase in risk of respiratory or viral infection, which is absolutely fascinating. From 1970s. There was this couple, I forget their name, John and Anne Murray, and they were practicing in Africa where they had a lot of famine, and they were actually refeeding a lot of the starving local populace. And they actually had documented multiple times that grain-based refeeding appeared to reactivate latent infections. So you'd have people with a tuberculosis infection that was quiescent. It was in the body, but it was under control. It was in check. It wasn't causing any draining pustules or anything like that. They might have had some large lymph nodes or something like that, but nothing too much going on. And reliably, if they had patients like this, if they fed them grains, they were no longer starving, the disease would take off. And I'm wondering whether it was basically because the grains were carbohydrate rich that they were then inducing insulin resistance and basically impairing the efficacy of the immune system. And there is actually some other interesting studies too. So there's been a paper that was published in 2017, and it was looking at patients who were ventilated non-invasively, which means they didn't have the tubes down their throat. They basically just had a pressure mask or something like that, or just plain oxygen. And they found that if these patients couldn't feed normally, presumably because they were too breathless, they either had the choice of giving them nothing or giving them feeds through a tube, usually a nasogastric tube through the nose, or other ways they can feed it. They actually found that if they fed them, if for the first 48 hours, if they fasted, they actually did better than if they were artificially fed. And again, I suspect this probably reflects the fact that these feeds that they give people in hospital through tubes is basically ultra-processed junk food. It's nothing but sugar and vegetable oils. And that's going to be the most insulin-resistant inducing substance known to man. So I'm not particularly surprised that they had worse outcomes when they were actually fed rather than being fasted, at least in this study.